As we've discussed to this point, there are no curative treatments for hand osteoarthritis, and it is slowly progressive over time. However, as I tell my patients, it's not a linear progression. It is not consistently worse, worse, worse every single day. It's up and down. So there are periods of flare and periods of quiet where it's really not as painful. And that's normal in this condition. So we don't have to expect that every day will be worse than the last. Most cases of hand osteoarthritis can be managed in conjunction with your primary care provider and potentially with an occupational therapist, as earlier discussed. Not all hand osteoarthritis requires referral to rheumatology, particularly given that there are no specific therapies to halt progression of hand OA. However, there are some warning signs that you should look for to consider referral to rheumatology, including very prolonged morning stiffness of more than an hour, keeping in mind that many people with erosive hand OA will have up to an hour of morning stiffness, at least on some days. Very red, warm, swollen joints are not typical for osteoarthritis, although mild swelling and very slight warmth can be seen. If there are episodes of very severe redness, warmth, and swelling, this may indicate another condition and should be further evaluated. Most osteoarthritis gets worse as the day goes on. So there's a little stiffness in the morning, perhaps after activities, but by the end of the day is really the worst time of day. If an individual has stiffness and pain only in the morning that resolves completely with activity and stays gone throughout the day, this may indicate a more systemic inflammatory process. Again, erosions on radiograph alone do not mean that there is a systemic inflammatory arthritis at play and may be due to osteoarthritis given the appropriate clinical setting.